session. Let the minutes reflect we have a full quorum. All the members of the court are here. We'll begin with Commissioner Martin giving us, delivering a prayer, and then we'll have the Pledge of Allegiance to the flag and Texas flag.
You bow your heads and pray with me. Heavenly Father, it's an honor to be in your presence today where we live in a country where we're free to worship you as we please. And Father, we just thank you for the recent rains that you have sent us. Some got them and some didn't. And Lord, we would just really appreciate if you'd bless us with some more. And Father, we thank you. We adore you. We appreciate everything that you do for us. Lord, just help this court today to conduct its business. In Jesus' name I pray. Amen.
Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible.
Oh, okay. Wow. Sorry. Get a copy. All right, we're going to move to agenda item number 3, public comments. Do we have anybody signed up for public comment? No. Okay. Agenda item number 4, we have some certificates and completion of award that we need to put into the minutes. We'll begin with the first one. Commissioner Paradola completed 11 hours of educational training. South Texas County Judges and Commissioners Annual Conference. Kenneth Miller completed his medical countermeasures point of dispensing, planning, and response, 16 hours. John Holcomb completed his cyber security awareness training. Brenda Trevino completed 4 hours of educational training on county budget administrative training. Commissioner King completed 8 hours at the South Texas Judges and Commissioners Annual Conference. Commissioner Aiken completed his cyber awareness training. Commissioner Martin completed his South Texas County and Judges Commissioners Annual Conference, 11 hours. Also with Commissioner Aiken, he completed the same hours. Ruby Camarillo completed 2 hours of manufactured housing, boat, and motor title registration. Amanda Bravo completed her cyber awareness training. Brenda Trevino completed her cyber security awareness training. And Kayla Prado completed her cyber security awareness training. Let those go into the minutes. We're going to move to agenda item number 5. We have Audrey Lewis, our 81st Judicial District Attorney, information and request for consideration on interlocal agreement resolution for a regional medical examiner's office. Ms. Lewis, you have the floor.
Good morning, Your Honor. Good morning, Commissioners. I appreciate your time this morning. I put on your desks a couple of things for you to look at. One is the spreadsheet. The other is a copy of the interlocal agreement. If you will do me the favor of, I'm going to start assuming that you guys don't know and are not aware of the medical examiner situation that's faced by not only this county, but really all of South Texas. So back in 2020, when COVID hit, at that time, the medical examiner's office that we all utilized, at least 4 of the 5 counties in my district, was Bexar County. And they closed off services to us during COVID and have never reopened those doors, and have no intention of reopening those doors. So that put a lot of us in a big bind. We immediately transferred and notified JPs to start using Nueces County. Nueces County medical examiner came under indictment. We notified law enforcement agencies we may have to exhume bodies. It became a really big problem. They have since, off and on, also shut us down from services, for medical examiner services, because of their influx of cases as well. So currently, where most of our autopsies go to is to Lockhart, which is a private medical examiner's office. So, and for now, that's working in a pinch, but we are in a state of dire need for medical examiners. And it's not true, it's true of the entire state of Texas, but it's true across the nation. There's just not enough medical examiners coming out of med school. There's not enough that are wanting to do that work. So I met with the county judges, and actually the Bexar County Chief Medical Examiner and I met with ACOG County judges back in 2021 to kind of make them aware that this was not going away and this problem was not going to get any better. And at that time, I think everyone kind of thought, this probably will get better. But it's only gotten worse, quite frankly. So I've met with the county judges to discuss the potential of a regional medical examiner's office. There is no other regional medical examiner's office in the entire state of Texas. So we will be the first, but truly other than Nueces and Webb County. So Webb County serves LaSalle County as part of my district. But those are the only two medical examiners for South Texas, in addition to Lockhart's private services. So what this would allow is for us to have absolute consistent services for our region without the ability, they cannot turn this away because truly it is your medical examiner's office. And then also for other surrounding counties to do what we have been doing and you guys have budgeted for, which is to pay fee-for-service for autopsies. So, other counties would come to our jurisdiction, to our medical examiner's office and pay whatever it is that you as a board of directors would set as the fee per autopsy, $4,000, $5,000, whatever that may be. But what it provides for us is essential services that are necessary. And I know that you guys were not on the Commissioner's Court back a decade ago when we started the Child Advocacy Center, but it started this exact same way. Our sexually abused kids had been being serviced through Child Safe in Bexar County, and they basically told us we don't have the ability to provide forensic interviews to your abused kids anymore. So we had no choice. And I feel like that's really where we're at in terms of medical examiner service. It is something that we have to have as a community. So I've provided you guys, the first page of the spreadsheet is kind of rough upfront building costs, which is estimated at $5.3 million, right? Cannot make you any promises, but I have reached out to the governor's office. The governor's office is well aware that this is a crisis, not only unique to South Texas, but all over the state of Texas. But we are the only ones that seem to be taking the initiative to do anything about it. And so they are very interested in providing grant funding for the building. So that grant is due August 11th. We would know by the end of August whether or not we get that. I'm asking for the full funding for the building in its entirety. So God willing, that will happen. And so if that happens, that eliminates all of this upfront cost. And so you guys are aware, I know that some of you are new to the court. There is, the way that this would operate is exact same as the way the district judge's budget and my budget operates. So it would be on a pro rata basis. So your portion, Wilson County's portion is 35.92%, and that is based on the 2020 census population at this point. So the second page is a rough estimate of annual operating costs. So this would be the annual budget. And I say rough because you can tell, I mean, my budget's longer than this, so it's not quite itemized down to the T, but it gives you a really kind of general understanding. The yellow highlighted on both pages is what we would add for a toxicology lab. So in meeting with the medical examiner consultant that we have, we kind of tossed it back and forth in terms of whether or not we should have a toxicology lab. But you guys know as well as I do that things like fentanyl, methamphetamine, all those things play into a lot of our deaths now. And so an autopsy is never complete until we have the toxicology lab back. If we send that out, that rough estimate for tox which I think was like $50,000. To me, it makes more sense to have our own toxicology lab, because then the autopsy is complete. We have our own toxicology. Our medical examiner is who comes in and testifies about the toxicology. If we ship that out to another agency, it's usually out-of-state lab, it will cost us thousands upon thousands if we're able to subpoena them to come back to testify. And a lot of times they don't want to. So it creates a lot more hassle. So my thought is, if we're doing this, let's do it right. Let's include the toxicology lab from the get-go. Because we would, at some point, it would definitely be a necessity, because we're going to outspend what we're going to save by not having it. So the last page of your spreadsheet is just to give you kind of an idea of how many autopsies are done annually by county. If you look, Atascosa, unfortunately, always wins in that area. So their average is 24 autopsies a year. Wilson's is 17, and that's even including our Sutherland Springs shooting. So probably even a little bit less than that. So, and then Carnes, Frio, LaSalle. I also included Medina and Uvalde just because at the time, and we were kind of tinkering with the idea of, do we want to bring in, and that's something for you guys to decide, bring in other counties. The only problem is, of course, when you do that, that's more administrators and red tape that goes along with it versus just having them pay fee for service. They can pay us for autopsies. So, what questions can I answer? I know this is a lot to digest, and it's a large chunk of taxpayer money. There's no question about that. Yes, ma'am.
Where would this be housed? Where would it, which county? And are you already building in place, or are you ground up if this grant is given?
So the consultant says it's almost impossible to use an existing building because of the drainage involved needed for the autopsy room. And that medical examiners' offices who have used existing buildings, it's ended up costing them more to try to correct that drainage than to start from scratch. So when I presented this to Atascosa Commissioners Court, they have already approved it. They did not make the pledge, and I suggested that I come to each of the 5 commissioners' courts to make sure you guys are on board first, but it sounds as though they are going to pledge a 2-acre plot of land in Pleasanton, which would be in the city limits. And the reason that's important is because you have to have city sewage, but then they also have to have this solid waste interceptor that's different from septic, but it's its own interceptor for the waste that accompanies autopsies. Does that make sense?
Yes, yes.
Okay, so I think that,
Where is Wilson County going to fit in the locale of all of this?
and I think either Wilson or Atascosa are ideal locations for it because we're close to San Antonio, so we can attract, very high educated, high quality employees that we're gonna want for these positions, and they can make the commute pretty easily. Whereas if it were obviously in Cotulla or something, that might be a little different story, driving 2 hours. So, and in addition to that, it's just, we have the most autopsies. Wilson and Atascosa do, so it just makes sense that way too. I will tell you that what I will stress, in my opinion, is if this is something you guys decide to do, is when if you're looking at the budget for their annual operating budget, it's almost 1.5 million is salary. And that's the bulk. That's the bulk of what most of our costs are, right? I would tell you that is something you definitely would not want to reduce because of the shortage. That's the only way we attract quality medical examiners. So, and I had one county judge when we met at ACOG that said, well, why can't we use local physicians to do when we're doing these partial autopsies and things like that? You have to have a forensic pathologist. It would be like me going to my dermatologist to do brain surgery. It's just a different different practice of medicine. And so it has to be the most qualified people. So
So I guess as part of the process, in order to apply for this grant, then you need approval from all the courts to have this organization.
Exactly.
So that's really, that's a driving point behind approving this to test the waters, I guess, so to speak.
right. So to give you an idea, I've kind of thought this through because my initial thought was I was going to ask for the moon on this grant. Because this grant funds starting September 1st, and it would end August 31st of '24. But the reality is, because I've gone through grant process now several times, we don't want to ask for more than what we're going to use because we won't get it the next time. Because what I was thinking was I'll ask for the building and then I'll ask for the operating budget too, because the governor's office seems pretty excited to help us and get this project up and going. But the reality is, by the time we go through administratively what needs to happen to get the architect, to get the facility, I just think it will probably take almost a year just to get a functional operating building. So I don't want to go in and ask for all of these salaries they've given to us and then we don't use the money, because then I won't be able to ask for it the next year. My thought is we ask for the building, see what they do and pray that they give it to us, and then come back next year and ask for operating. And if they don't, then
That was gonna be my question, if you knew if it's an ongoing grant that we would be able to apply for next year for operating costs.
it is for now. It's Operation Lone Star through the governor's office is what we're applying through. So as long as that remains in existence. So,
Well, I guess just how big a building are you looking at? Do you have any idea?
they're saying about 5,000 square feet with refrigeration. Refrigeration is a big part of it. And so I had a sketch, and I did not bring you the sketch of kind of what the building looked like, but just a rough sketch.
That'll be a pretty tall order to get blueprints and a building built in a year.
That's what I think. I think we'll be doing good if we get that far. So I think that's hurdle number one, is let's try to get through that part of the process first. So, and by the end of next month, I'll know our status on that grant. And if that grant, if they, for whatever reason, do not fund the building, then, I'll come back to you guys to talk about Plan B. So.
Well, let me chime in a little bit. I spent most of my last 20 years of my 34 years or 36 years of law enforcement in a medical examiner's office, observing those victims that I had to investigate that were killed. This is extremely important, and like Ms. Lewis said, I've had to reinvestigate exhumations that were done by a pathologist, not a forensic pathologist, that wasn't trained in this area, and come to find out there were homicides. They just got it wrong. So when you're dealing with equivocal homicide investigations, this is extremely important. Now, for the audience to know, when a person dies an unattended death, it should have an autopsy. Unless that patient or that person's under a doctor's care, they can sign off on that death certificate and say, okay, this is because of, they had heart conditions, they were suffering from cancer, but we're missing the boat on a lot of these investigations that really are homicides. And if we don't get this right on, we really need this. And by the way, we'll service other counties, so there's a way of funding this. But think about your loved one. If somebody ends up trying to wake a loved one up and they die in their sleep, wouldn't you want to know what happened? Other than, okay, we just can't afford to do an autopsy and we'll never know. So it's very much needed. I think this is going to be a groundbreaking for us because there is no other place in the state of Texas. I don't even think there's a place in the United States that has a regional medical examiner's office. I've worked around some of the greatest medical examiners. They're not making them anymore, like Ms. Lewis said. They're just not coming out of schools like that. And if this concept comes to fruition for our 81st Judicial District, you're not going to need one, we're going to need two. They're going to be really busy. But again, I want to go back, think about it. If it was your loved one, wouldn't you want to know what really happened on an unattended death? And so I've spoken with all the other judges, and they're very much in favor of going forward in this study to see how we can make this happen.
I think if you discuss it at all with your JPs, you will find they have been very frustrated because every time there is a death, it's an issue now, is where can we take the body?
What I was gonna ask you is, can you share with us what the issues are that you're experiencing with our current provider?
Well, sometimes they just say no. We're at capacity, we don't have the ability, or the Lockhart medical examiner is a one-woman shop, and so when she is gone for a week, it's no. So, you know, and the next furthest is Travis County, so you're going all the way to Austin now. So it's just, the resources just aren't here.
Let's talk about Webb County. Dr. Stern has 2 semi-refrigeration trailers that are full of bodies, mainly migrants that have died crossing the river or died of the elements, and there's no way, they're still trying to find the loved ones where they're from so they can get the body back home.
I have one more question. If we get the grant in full for the building, do you anticipate any additional costs to be budgeted by the counties for the construction or the land or anything within the next fiscal year if that grant is paid, if that grant is in full?
In the '24 fiscal year, what y'all are budgeting for now, my hope and prayer is not. We want to make that grant as inclusive as absolutely possible, to where there's not some cost that we missed. So that's what we are working on currently.
So
And I am by no means a contractor, but
Yeah, so
we're
we're
working
not
on it.
looking at our pro rata portion until fiscal year '25 is
Yeah.
what,
Praying that the governor's office gives us the funding for the building, yes. And unless God, you know, somehow or other this building gets erected and done and everything's quicker, then there may be some, you know, if we get up and operate, because obviously the sooner we're up and operating, the better it is for everybody. But I just don't know that, I think realistically, we're saying August of next year is probably,
Yeah, I don't think you'll be done because, you know, you've got 30 days to pick an architect, 30 days to
Exactly.
contract, 3 or 4 months of design, probably a year construction period. And you got specialty items, so it may be longer than that, so, yeah.
Exactly.
It's gonna be a tough one.
yeah, it's not just a normal facility, so.
And having our own toxicology, and just what I have seen in the past, the delay is not there anymore. We get a full autopsy, the toxicology comes in. If you contract that out, it could be 6 to 8 weeks, 3 months before you get the report back, and you still have an incomplete
Oh,
autopsy.
we're waiting 6 months.
6 months, okay.
On some, because Lockhart does not have a toxicology lab, so, you know, and then the problem becomes, is someone from Virginia gonna come testify for us? And if they do, it's gonna cost us another $7,000. So,
do you know, would all of the personnel be county employees or would it be a separate entity by?
so the way that the interlocal is written is that Atascosa would, the same way that my office is, where my office is Atascosa County employees, right? And so it would be the same way. They would be Atascosa County employees, with them being the financial fiduciary of the grant and of, you know, so it would be the same kind of thing where you would pay pro rata to Atascosa County. Just because I think it is easier to keep it consistent in that way. The other part of it is that the way that it would be governed is similar to the way that y'all established the PDO. So it would be 2 from this court, 2 from Atascosa Court, and then 1 from Carnes Frio and LaSalle Commissioners Court that would serve as the administrating board, would decide hiring and firing of the chief medical examiner, would just, you know, take care of the operating budget for the medical examiner's office.
Thank you, Ms. Wilson, appreciate it.
Yes, thank y'all very much for your time. I appreciate it.
Sorry.
Commissioners want to take any action today, or is it just informal
Yeah, we're going to discuss the interlocal agreement, it just, to adopt it so that we can move forward. That's the only thing we're doing.
Yes, my hope is to take action on that.
Her
So,
part was informative, and then we'll vote on that, okay?
thank you.
Thank you. All right, Commissioners, 5B, discussion and possible action to join Atascosa County, LaSalle County, Frio County, Karnes County in the adoption of an interlocal agreement, South Texas Regional Examiner's Office. I'll entertain a motion.
Judge, I'll make a motion to join the Atascosa, LaSalle, Frio, and Karnes County interlocal agreement for the South Texas Regional. I'm assuming it's Medical Examiner's Office, right?
It should say yes.
Okay.
Second.
Motion made by Commissioner Martin, seconded by Commissioner King. Is there any other discussion? Hearing none, I'll call for the vote. All those in favor say aye.
Aye.
All those against, motion passes. Agenda item number 6, discuss and take action on reappointment of Joanne Brechtel as Board Trustee of the Camino Real Community Service Board. It's a 2-year term, and it'll run from September 1st, 2023 till August 31st, 2025. She's been in that position already. She's doing a great job, and she'd like to continue her work there. I'll entertain a motion.
I'll make a motion that we reappoint Joanne Riechel to the Board of Trustee of Camino Real Community Services Board.
Motion made by Commissioner Perdola. Is there a second?
Second.
Seconded by Commissioner Martin. Is there any other discussion? Hearing none, I'll call for the vote. All those in favor say aye.
Aye.
All those against, motion passes. Agenda item number 7, County Sheriff Jim Stewart discuss and take possible action related to purchasing of radios for Poth and Three Oaks Volunteer Fire Department and the county jail. Sheriff, you have the podium.
I think we discussed this 1 or 2 meetings ago. I believe I have everything on board. I have a contract from LCRA for purchase of these radios at $2,750 apiece. We're going to split it into 2 pieces. First one now to get the volunteers up and running. The other one will be to finish out the commissioners' radios and stuff on next year's budget. I've talked to the auditor. I think we have located the monies in place, and I guess I'll let her talk to that.
Yes, so I passed out a letter from the Poth Volunteer Fire Department. What the sheriff is recommending is at $2,750 each radio for the 25 radios that he wants to purchase now. 10 of them would be for Poth, 10 would be for Three Oaks, and 5 would be for our county jail. That total is $68,750. Out of that amount, he's requesting to utilize the opioid settlement money that we've received, which is $37,994.97. The letter before you is a letter of commitment from the Poth Volunteer Fire Department to pay $15,000 toward the purchase of their radios, which leaves a balance of $15,755.03. And so the sheriff currently does not have it available in his current budget. So we do have money available in our non-departmental contingency line item if you would like to consider the difference of the $15,755 to be taken from that line item. And you may be asking why Three Oaks is not included in the payment of them. They are very small VFD, and our annual payment to them is only $6,000 to begin with, and they have very, very small budget. So I think Sheriff and I agree.
Yes, and I think we looked at their account, and there's no point in putting them in a bind
Right.
to ask them for that money back.
Well, Commissioners, you all know the most important thing to a first responder is communication, so we need to think about this seriously, and I'll entertain a motion.
You could also,
I'll make a motion to purchase 25 radios for use for the Poth, Three Oaks Fire Departments and the county jail, and to use the funding as described from the opioid settlement and payment from the Poth Fire Department, and to take the remaining balance from the non-departmental contingency fund.
I'll second.
Motion made by Commissioner Martin, seconded by Commissioner King. Is there any other discussion?
Just a quick question, what will that bring the balance down to? After we take the 15,755, what's going to be left in the opioid?
I don't have that number with me. I'd have to get it to you from my office after court. I can get it for you.
Okay,
It won't be
It
beyond that
probably
balance.
no, it's
Okay.
probably about 100,000 or so that would be left. Sheriff, the only question I had was, is LCRA going to bill you like a separate contract for all of those, or a separate bill for all of those, and then we're gonna turn around and bill Poth so that they pay our portion? Okay, we'll turn around and send an invoice to Poth, so we're gonna remember that, Christina. Okay.
the outdated radios or the up-to-date radios or
These are going to be
older models?
brand new, but older model radios. It will have the same function as what you're currently using.
And
But it will give them function.
do they have a full warranty like the new radios?
They got a 1 year,
That what the other ones have also?
I think the brand new ones, they cost $10,000 a piece.
Okay, Sheriff, let me come on up to the podium because the audience can't hear you that's watching, and explain that to them, what those radios are going to do.
Okay, the radios being purchased for the volunteer fire departments, they have the same functionality as the radios that y'all currently have from the new system. They are brand-new radios. I think LCRA's contract said refurbished. When I talked to the gentleman, he said they were brand-new. They just never been used. They are no longer made. They've been repurposed with the version that we're using right now. But the version we use right now costs $10,000-something. These radios cost $2,700. If we use them for 2-3 years, and I think I've built in a purchase of 7 replacements, so if 7 of them go bad, we've got replacements for them. We should be good for years, and then we can figure on what we need in the future. We can buy as we need it and not have to make that large purchase at $10,000 a piece. Because if I'd have done this with the same radios that y'all are currently using, 25 radios would have cost us $250,000. But we can make this work for total 45 radios are like $123,000.
Yeah, so the sheriff, we included the additional purchases for the new fiscal year budget out of his budget. So an additional $55,000 has been proposed in his fiscal
In
year.
my budget for the next year.
And that is to replace the ones that you guys have, plus keep 8 on hand for spare radios.
And I believe you have an email, Judge, from LCRA that I forwarded that has the contract in it for the design, just like we talked today. 25 now at that price and 20 on the next year's budget.
I have it. I do. Thank you, Sheriff.
Yes, sir.
Any other discussion, Commissioners? Not a call for the vote. All those in favor say aye.
Aye.
All those against? Motion passes. Agenda item number 8, we have Ms. Trevino, County Auditor Report. Discuss and take possible action on employee and retire health benefits for fiscal year '24.
Judge, I'm going to stand at the podium so that
Yes, please.
Okay, the insurance committee met a couple of weeks ago. Commissioner King, Commissioner Aiken are on the committee along with myself, our tax assessor, Jalen, Christina, our treasurer, a couple of other people. And we reviewed all of the updated cost for our health insurance, as Tally Benefits is our managing agent for that. Currently, our employees are on Aetna Health Insurance, which this is year 1. We switched to Aetna last year. After reviewing the cost, there is a rate increase It's not specific to Wilson County. There's insurance rates across the nation are increasing substantially. So it is, and specifically just for employee only, it's a 9.65% rate increase. Our current rate for employee only is $646.73 a month. A current rate, or the renewal rate is going to be $709.15 a month, which equates to $8,509.80 per year per employee. The employees would still have the option for the buy-up in terms of the deductible, yes, the deductible that they wish to have. But at this point, the committee feels that it is in the county's best interest to renew with Aetna, just because this rate is actually lower still than what we have paid in the past. 4 years ago, the rate was even higher than this. So we're still at a good rate, and we believe that this is the best option to continue providing the benefit in full to our employees. With that being said, one of the other considerations for you is we also provide this benefit to retirees as well. The committee, we have 18 retirees that are on the full benefit package. The committee is recommending that we start at this fiscal year continuing to provide that benefit, but at a shared cost. So the consideration is to notify all of the retirees that effective October 1st, we are recommending a 25% share cost, and the county will pick that up, and then we can review it again next year. The reason that we're recommending that is because of the cost increase, and in order to still continue providing health coverage paid 100% by the county for employees, this is one of the ways that we can continue that for our current employees. I also have Jason Talley is here as well, that he can answer any questions that you may have related specifically to the plan in general, or anything like that.
Before we ask Mr. Talley to come up, if he has anything to add, and we thank you for being here, Mr. Talley. What happens when our retired employees transition to Medicare? What happens after?
So the retiree benefit is only up until the age of 65, yes, and then they automatically come off. However, out of the 18, we only have 2 that are close to that age.
And
Go ahead.
you said it was a 75-25 split. Which is the county portion?
The county's portion would be 75%, the retiree would be 25%. And then we would revisit next year to see where we're at. If we keep it at 25, do we go up? It just depends on the rates in general and what the cost is to the county.
Well, I, for one, am not happy with the Aetna policy at all. My cost on my medicines have doubled from what they were with Blue Cross, and Aetna is not paying. It's cost me a fortune this last year to be with Aetna Insurance. Am I correct in saying the family plan, you gotta meet a $12,000 deductible before the insurance kicks in?
I don't recall what the family deductible.
Come on up, Mr. Talley. Come on up, sir.
The deductible for plan year is, if in-network, is $2,000 individual and $4,000 for family for in-network.
They both have to be met before the insurance pays anything.
Well, so once an individual meets their deductible, then the plan starts paying co-insurance. So you have a co-insurance share after that deductible's met. Now, what you might be referring to is possibly an out-of-network deductible, because if you do go out-of-network of the Aetna network, then you have a much higher out-of-pocket to meet. And so that might be the case there. One of the challenges that we're just seeing across the board, and you know, this is my 28th year in the employee benefits business, so we've been doing this a while. We're just seeing unprecedented rate increases everywhere. And a lot of it's driven by specialty medications, which are very, very costly. And I know that because I see what these costs are. It's very common for a specialty drug to run on the low side of $4,500 an injection to $10,000 an injection. I have a gentleman on one case that is basically $20,000 a month just for 2 injections a month. That's $240,000 just on one specialty drug. So they're very, very good when we need them, but they're very, very costly. And specialty drugs treat a lot of autoimmune diseases, which are very, very difficult to get under control. I know that because my 29-year-old daughter has one. And we're very thankful we have these medications, but we're seeing a huge increase in the medication side of these plans. So somewhere upward around 45, sometimes 50% of the cost on these plans can be run by the prescription costs going up. And so the other thing that's been a challenge for us is that Humana made an announcement in February of 2023 that they're exiting the group health market. So that's one less carrier that we have. So we represent, of course, Blue Cross Blue Shield, Cigna, Aetna, Humana, United Healthcare. But Humana was always a good place to go for counties, for cities, entities like this. And now they're totally out of the business. They're only going to be working on Medicare type plans in the future. That's what Humana will be doing. So that being said, we have one less carrier. So, when we look at renewals like this, part of the challenge when you make a change is naturally any new change, you have to get prior authorizations for any medications that a person might be currently on, that they're getting covered on the current plan. The other challenge is that we're seeing it across the board. Blue Cross, Cigna, United Healthcare, a higher amount of scrutiny getting some of these medications paid because of their cost. We don't see much of a challenge on the inpatient side or the physician side of things. It just really lately has been the medications that have been a real challenge. So unfortunately, even if we were to move a plan, I don't think it would resolve some of those challenges. And that's when the physician becomes your real ally there. Yes, there's hoops that they have them jump through, but you got to realize a lot of these companies are all profit companies. Well, they all are. And naturally, they try to make sure that if you have to take something, that they're going to make sure that the other process has been done to get to that high dollar medication. And it's very frustrating, but I deal with it on a daily basis. But it's not just Aetna, it's across the board. And we did last year go out for public bid and bid all the different companies. The county did a public bid. We did talk about even plan changes, but the reality is we might need that option for next year. Look at a plan change to keep that cost down. And that might mean deductible changes, things like that.
All I know it's cost me more than double this year having Aetna insurance than the year before.
Yeah.
They're very difficult to work with.
Mm-hmm.
They deny medications every time. Even medications that I've been on for years, they denied them, and I had to fight and fight and fight
Yeah.
to get them to cover them. And then once they did, they finally did. But
Mm-hmm.
every time we go to pick up medication, it's a fight with Aetna insurance.
Yeah.
And that gets old.
I know it. Believe me, I've been doing it for 28 years. I understand how old it
Saying is,
gets.
I didn't have those same fights when we had the Blue Cross, either one of the Blue Cross policies. This past year's been a nightmare for me with that insurance.
Sure.
So I, for one, am not happy with that insurance.
Any
If
other?
you don't need it, or if you don't have any illness in your family, you're lucky. But if you have someone that's sick, it's horrible.
Any other questions?
Thank you, Mr. Cook.
You bet. You bet.
So the request from the court, again, is to approve the renewal of the contract of the health benefits through Aetna, everything remaining the same. We wouldn't, I think Jalen discussed this with Jason, we wouldn't necessarily need to have onboarding, re-enrollment meetings as we've had in the past. I think that's what Jalen said, because there wouldn't, it may be a few here and there, but it wouldn't be like onboarding brand-new people all over again. In terms of dollars, we're looking at, total cost is about 1.25 million is the county's portion, is what we pay in, per year for the employees, excuse me. An additional 154,000 is for the retirees.
May I add something?
Yes, sir. Come on up, sir.
Yeah, one of the things I didn't discuss is that we currently have a loss ratio that's 105%, which simply means that for every dollar we paid in premium, we paid $1.05 in claims. So our claims projection is not running the direction that we hope to be running, okay? If we would have been running anywhere from 80 to 85%, there's a very good possibility that we could have probably had a rate pass. That might have been even difficult. So really what we're seeing is that this 9.65% is really more of a trend rate increase, because naturally the cost of everything in the medical world is going to cost more next year, and so naturally they're just adding a trend cost. So I feel very fortunate that we only had a 9.65% increase. I know that we never want an increase, but it could have very easily been anywhere from 20 to 25% with the loss ratio running where we're at. And it's not so much the history. We have about 6 claimants that we're seeing that there might be costing more down the road, and that's really what the underwriters are looking at. So I just want to be sure that you were aware of the fact that the snapshot that we have right now, the plan, is running a little hot in terms of claims. And naturally, claims is what drives us, okay? So I just want to be sure that I added that.
Yes, and one more thing also to add. Prior to last year, when we had our coverage with TAC, the cost per employee was close to $900 per employee, which is what drove us for the committee to make the decision to go out for bid. When we went out for bid, we went ahead and went with an HMO, which is what was last year's plan. And I can tell you, and I'm just speaking for Jalen because she's not here today, the amount of concerns and complaints regarding last year's plan being an HMO out of network, it was a nightmare. And that brought us down to a very, very low dollar amount. Then we decided to go ahead and move forward and switch to Aetna. We did discuss in our committee, one of the questions, I believe it was one of the commissioners asked Jalen, are we seeing a lot, is she seeing a lot of these complaints and concerns with Aetna? Should we look at possibly going out? And she said out of the 100, and I believe we have 106.
Rounded off.
Yeah, close to 160 employees. I think she said she had about 2 out of that were having some issues. So that was much more pleasing to our ears than the year past. So again, we're going from $646.73 per employee. And we also knew last year that the chances of us getting a rate increase for this year was probably high because it was our first year with it. And anyway, so it's good to know that the rate increase is not specific just because we went with them year one, but it is nationwide. So again, $709.15 per month, $8509.80 per year per employee, and then a 25% reduction in the retirees.
So the county doesn't pay for mine, so I'm going to ask, I have my own health insurance. So is this still a PPO under?
It is still a PPO. Nothing changes with the plan.
It's not an HMO then?
It is not an HMO. No, sir. It is still a PPO. The employees still have the option of adding their spouse at one rate, their children, or their entire family. Those rates have increased as well and will be given to the employees at their option whether to keep or remove those benefits.
I'd like to chime in. Mr. Talley, you came back up and stole my thunder. I was going to bring up the 105% loss ratio. You know, the fact that a company is in business to serve, but it's in business to make money, whenever you're upside down that way, you're going to get a cost increase. There's no other choice but for them to take and ask for a higher premium. And also, I'd like to let everybody know in the public that it took a long time deliberating within the committee to come to terms with the fact that we were going to have to ask for the 25% from retirees. We were faced with, if we were going to be able to keep it within budget, asking our current employees to take and pay more for their premiums, or to look at a way on dealing with the cost of the plan on the back end. And I just want that to be known that there was a lot of deliberation that took place in the committee over exactly how to get control of these plan costs.
That is true. Some of the things that were brought up in the committee meeting, having some type of an awareness or health fair for our employees to educate them on the importance of preventative measures, because those numbers are significantly low on our plan right now. We don't see a lot of men and women doing their annual exams. And also educating them about the use of emergency room visits versus urgent care visits. Those drive up our cost as well, and people are running to the standalone emergency room clinics, and it's charging an emergency room copay versus doing an urgent care or a virtual visit, which is something that is also offered. So we're going to talk about doing some of those types of things too throughout the next fiscal year. Getting Jalen some help will definitely help that help as well. So, any other questions? Okay.
Any other questions? All right, Commissioners, I'll entertain a motion approving the employee and retirement health benefits for fiscal year '24.
Judge, I'll make a motion to approve the employee and retirement health benefits for FY '24.
Second.
Motion made by Commissioner King, seconded by Commissioner Aiken. Is there any other discussion? Hearing none, I'll call for the vote. All those in favor say aye.
Aye.
All those against? Motion passes. I'm going to entertain a motion to suspend the rules because we have a public hearing coming up at 10 o'clock. So if suspend the rules means just put it to rest right now, and then we'll reconvene. Have a motion to suspend the rules, to move to action item number 11D.
Motion.
Motion made by Commissioner Aiken.
Second.
Seconded by Commissioner Paradola. All those in favor say aye.
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 We stand in recess until 10 o'clock.